All right. Hello and good morning to participants joining us from North and South America, and good afternoon or good evening to those joining us from Europe, Africa, the Middle East, Asia, and the Pacific. My name is Jacob Baticki, and I'm the Director of Education and Advocacy of the University of Miami Public Health Policy Lab. We are very pleased to welcome you to this virtual panel of the Global Health Council's 2024 Global Health Landscape Symposium, Advancing Global Health Equity Through Accountability. Today's panel brings together esteemed leaders from diverse areas of public health, advocacy, law, and international relations to discuss accountability within the global health architecture and the role of accountability in ensuring equity through the WHO Pandemic Agreement. It is my pleasure to introduce our speakers for this virtual session, starting with our moderator, Dr. Winnie Panju Shumbusho. Dr. Winnie Panju Shumbusho is the chair of Board of Uniting to Combat Neglected Diseases, global trustee and global board member of Save the Children International, and member of the panel for a Global Public Health Convention, among many other respected roles. She previously served as the WHO's Assistant Director General for HIV/AIDS, tuberculosis, malaria, and neglected tropical diseases. She also played a key role in mobilizing political commitment, resources, and action needed to combat HIV/AIDS, TB, malaria, and neglected tropical diseases, and building resilient health systems, including in the founding, governance, and efficacy of the Global Fund, for which she served as board member. Our panelist, Dame Barbara Stocking, has spent much of her working life on healthcare, including as a member of the top team of the United Kingdom's National Health Service for 8 years. She was requested to chair the panel, which assessed the WHO's performance on Ebola in 2014, and more recently is currently chair of the panel for a Global Public Health Convention. Dame Stocking's other main commitment was to international development as chief executive of Oxfam Great Britain from 2001 to 2013. She also served as president of Murray Edwards College, University of Cambridge from 2013 to 2021. Our panelist, Dr. Maria Juliana Tenorio Quintero, serves as health attaché for the Geneva mission of the Government of Colombia as a member of the Colombian Foreign Service. She has over 18 years of experience in international affairs at the Ministry of Foreign Affairs of Colombia. Her research interests include public international law and its intersection with global public health. Dr. Tenorio Quintero holds a Doctor of Philosophy in Public International Law from Universidad de Buenos Aires, a Master of Laws in Public International Law from Leiden University, and graduated with honors from the Faculty of Law at Universidad Buenaventura de Cali. Our panelist, Dr. Stephen Hoffman, is Chief of Staff at Wellcome Trust and a Professor of Global Health, Law, and Political Science at York University, where he holds the Daidali Distinguished Chair in Global Governance and Legal Epidemiology, and serves as Director of the Global Strategy Lab and Director of the WHO Collaborating Center on Global Governance of Antimicrobial Resistance. Dr. Hoffman is an international lawyer licensed in both Ontario and New York, who specializes in global health law, global governance, and institutional design. He previously served as the scientific director of the Canadian Institutes of Health Research's Institute of Population and Public Health, and as the Assistant Deputy Minister for Data, Surveillance, and Foresight at the Public Health Agency of Canada. I now invite our moderator, Dr. Winnie Panju Shumbusho, for a welcome and opening remarks. Thank you.
Thank you very much, Steve, and good morning, good afternoon, good evening, wherever you're joining us from. Thank you so much for asking me to moderate this panel. And as Steve has said, we will explore governance and accountability models for the WHO Pandemic Agreement and discuss the various commitments of stakeholders in the global health architecture for pandemic prevention, preparedness, and response, which we acronym as PPPR. We will then highlight the importance of including in the WHO Pandemic Agreement a mechanism that guarantees access for low and middle income countries to medical countermeasures in future pandemics while preserving the innovation ecosystem that allowed us to succeed in the last pandemic. So in the next 15 minutes, our distinguished panelists, Barbara, Maria, and Steve will give us introductory remarks on the key areas. We will then have a 20-minute moderated discussion with our three panelists, followed by a Q&A with the audience. So a few housekeeping rules for our distinguished panelists. In the introductory remarks, please try to confine yourself to 5 minutes each so that we can leave room for discussion and also for a Q&A with our audience. We are hoping that by the end of this session, all those attending or able to access this session virtually will be able to understand accountability within the global health architecture and the role of accountability in ensuring equity. And also to recognize what governance and accountability mechanisms will ensure durable commitment to country obligations set forth in the WHO pandemic agreement. We're also hoping that you will be able to recognize what forms of accountability mechanisms for PPPR may take, building on existing international mechanisms, and how the gap between idealism and realism can be bridged. Also, hopefully, we will be able to understand how to incentivize more collaboration and compliance for PPPR in the global health architecture. So let me start with you, Barbara. If you can give us your introductory remarks and possibly cover what is meant by accountability in the IHR and the pandemic agreement. For example, accountability among and between countries, what meaningful accountability looks like in practice, and so on and so forth. Over to you, Barbara.
Yeah, thank you very much, Winnie, and hello to all of you listening in. I would like to begin with what accountability means. It starts with a commitment, say, of a body or a government to do specific actions or not to do them. But that's not enough. The accountability comes in when, say, the country agrees that it is going to be transparent about what it's doing, in the light of those commitments, and also available to have data and so on, to have others to assess. So being open entirely about whether they have done the things they were meant to do. Now, coming into the international health regulations and the pandemic agreement, I think accountability is twofold. As Winnie implied, it's the accountability of countries to each other, and if you like, the global part of that. But most importantly, it's also about accountability to people's country, the citizens of the country. Transparency and assessment are really vital if civil society organisations and parliaments are able to challenge their own governments about delivering what they promised. So how does that happen in the treaties? Well, first of all, it's quite clear that self-assessment is inadequate, nor is peer review by other countries good enough. They're either likely to be too harsh or more likely to be too accepting because they know they themselves will be reviewed further on. For the IHR, the International Health Regulations, there's already an agreement now to have a committee on implementation, backed up by a small technical body. Something similar is likely to be agreed for the pandemic agreement. But these need to be really coordinated together because so much is covered in both of the treaties, and we can't afford to have two different sets of bodies. What we're also concerned about, though, is that in these discussions, there is no acceptance of independent assessment. And we think that is really vital. If people are to trust their own countries, and if countries are to trust each other, then independent assessment of what's happening is really important. We're also concerned at the moment that implementation is quite a loose word. We need to define clearly what is to be implemented. And that needs to be obviously taken up from what's written in the treaties. For example, it might be something that is for every country. What is each country doing? And that might be the development of health surveillance. But equally, implementation might mean a new structural change in terms of setting up a new financing mechanism. So there's certainly work to be done yet about what is going to be in those implementation issues. Now, I should say, there are real concerns about accountability, particularly from low and middle income countries. They are worried that they simply don't have the money to deliver. They're concerned that they are going to be blamed for not being able to do what's required. Now, this is especially true for the One Health agenda, where combining animal and health surveillance is going to require major investment. In the end, of course, we all want to deal with the root causes of pandemics, getting rid of wet markets and changing animal and human habitats. But these are major changes that are going to take time. So while we support proper assessment, we also think then the low and middle income countries must be given the means to be able to deliver what's spelt out in those treaties. For my final point, I just want to come back to equity. It's the most important word, actually, in the whole pandemic agreement. Now, you can't expect countries to deliver unless they have tests, vaccines, drugs, and other items available to them. Now, this is the most contentious part of the whole treaty. But if that's not delivered, it will be a huge loss to all countries. We can't stop outbreaks at the moment, nor can countries stop them becoming pandemics unless those countries have the resources and products to do so. And we all know that that has not yet happened and certainly did not take place for COVID-19. So I hope that's enough to give you a starter, and I'm looking forward to hearing Juliana on implementation too. Thank you.
Thank you so much, Barbara. And we'll come back to you later during the wider discussion. And now to you, Maria Juliana, please give us your introductory remarks on the current state of the WHO pandemic agreement and any implementation challenges and any other issues you've faced as part of the negotiating group for the pandemic agreement. Over to you, Juliana.
Thank you so much, Winnie and Barbara, and of course the organizers for inviting me to deliver a brief words on implementation. First of all, I do need to say my usual caveat, like this is not precisely the position of my government. It's just my personal views on an issue that I've been covering in WHO. So I won't be presenting the Colombians' positions on this. So to go to the specific questions of implementation, so I think a little bit of background will help us. So what is the pandemic agreement, or what the pandemic agreement intends to do? So we're basically dealing with a multilateral agreement that is trying to regulate the matters of PPR, so preparedness, prevention, and response in terms of pandemics. So we're talking about global commons. This is a very common term in international law right now, and it broadens up these issues that concern us all. So this is what we're trying to do here in WHO. So is to regulate a specific issue that it concerns us all as humankind, and having that in mind, it gives you like the differentiated perspective that you need to have in order to deal with this issue. So it's not a trade issue. It's not not sure, like it's not a private thing that we're dealing with. It's a public issue that it concerns us all. And so in that regard, and it's what we're trying to do here in the pandemic agreement, is just to try to see what other multilateral agreements perspectives we have in at hand. So the other agreements that deals with global commons are the multilateral environmental agreements. And I'm saying that because when we're dealing with multilateral environmental agreements, we also have the perspective of global commons, global public goods. And there are some tools that the multilateral environmental agreements from 30 years ago have been adopting in terms of helping member states or state parties to those agreements to implement and comply with the obligations they're acquiring when they ratify those agreements. And those are the implementation and compliance committees. So having that perspective with that view in mind and that experience is that we try to have this parallel mechanism in the pandemic agreement, and that is to try to include in the pandemic agreement a provision dealing with implementation and compliance committees. And I have to see, like, doing this background scenario, then we also have to make a difference between the different concepts we're dealing with. So Barbara talked about accountability, but there's also reporting, monitoring, implementation, and compliance that are closely interrelated, but they are different in nature. So what's going on with the pandemic agreement? So first of all, we have parallel process. We have the IHR amendments. The IHR stands for International Health Regulations, and we have the pandemic agreement. Those processes were conducted hand by hand between 2022 and now. In the pandemic agreement, we had an initial proposal by Colombia and the US on an implementation and compliance committee on its own. And then in the IHR, we also had an implementation and compliance committee proposals, 3 proposals by 3 different regions in the IHR. What happened in the IHR was that, as Barbara was mentioning, we could set up an implementation committee of the whole membership, that is the 184 member states of WHO that are going to make surveillance of the implementation of the IHR. And then we have a small committee, the technical committee that Barbara was referring to, that is called the Subcommittee on Implementation. That is what we have right now. In the pandemic agreement, we do no longer have the Implementation and Compliance Committee for the pandemic agreement. We have a brief reference to the Implementation Committee of the IHR, but also to that we can use any other arrangements that the WHO Constitution envisages. So that's what is happening right now. And I know that my time is up, but just to finalize. So, and perhaps we can have this discussion afterwards. What we're having right now is two options. Whether to have a cross-reference to what we're dealing in the IHR's regulations in terms of the implementation and the subcommittee on implementation, or whether to have a specialized body on its own for the pandemic agreement. And then we will need to have the discussion how to make the interconnection between the 2 bodies, realizing that this is a pandemic continuum. So from fakes to pandemics, we're just talking about the same issue. So that would be my final point, and I look forward for the conversation part, because I really want to hear from the audience in terms of these 2 views that I made at the end. Thank you.
Thank you so much, Maria Juliana. Now, over to you, Steve. If you can give us your introductory remarks on key issues of, for example, country commitments. What does this mean? Accountability mechanisms, compliance, and what is the real world impact of all this?
Great.
Over to you, Steve.
Thanks so much. First, a big thanks to the Global Health Council for organizing this conference, and to you, Winnie, and Jacob for organizing and chairing this session. When we think of this issue and we're thinking of international health regulations, a potential pandemic agreement, this is really a rather rare moment in global health where the tools of international law are being considered to being used in order to address global health challenges. Countries make commitments all the time to each other on various different issues. In fact, there's around 250,000 different treaties, most of which folks listening to this will not have heard of. So treaties are quite common. There's many of them. What's rare is how few times the world has decided to make use of international law to address global health challenges. This is one of those times where it is being used. The International Health Regulations is a legally binding instrument, and now potentially, if there is a pandemic agreement, that would be another one. I mention that because international law, for its strengths and its weaknesses, it is the strongest commitment mechanism that national governments have, that countries have, in order to make commitments to each other. So when Barbara was talking about accountability, this and that commitment is the first step of that. This is the strongest way in which countries can make that commitment, which is the start of accountability. But what's also clear from the science is that just because countries commit to do something doesn't mean they're necessarily going to do it, and doesn't mean they can necessarily count on each other to do it. And indeed, my colleagues and I at the Global Strategy Lab, we led the world's first, and at this point only, systematic review of all the quantitative impact evaluations of the effects of international treaties. We basically summarized quantitatively the impact, the findings of 224 individual primary studies to try to find out what treaties are more likely to achieve their intended goals and which ones are less likely. And what we found is the only statistically significant modifiable factor for a treaty to predict whether it's more likely to have an effect that's intended or not is whether that treaty includes accountability mechanisms. And so in that respect, probably it's maybe even intuitive that, okay, if you have an agreement, if there's no mechanisms to be held accountable for whether that actions or those commitments are actually followed through, it's of course more likely or not that it's going to happen. But the science now shows that. And that's basically a summary of 224 independent primary studies. And so what does that mean? Now that we have the benefit of that science, what's clear is that countries, when they make those commitments in the form of international agreements, such as the proposed pandemic agreement, countries make choices as to whether do they want this international treaty to really matter or not. And so I think one of the things that I think is great about this process is that there has been some focus on, okay, what could, for example, an implementation committee look like as part of a proposed pandemic agreement? And in particular, Juliana and Columbia and colleagues have been championing that opportunity, which is amazing. The challenge is whether it will get in, as Juliana's just updated us. There's still debates as will there actually be an implementation committee as part of a potential pandemic agreement? But even if there is, there's so many different mechanisms by which accountability could be promoted. And is an implementation committee the best way? What about ensuring data? What about enforcement mechanisms? Of course, the best accountability mechanism is the one that's politically feasible, that countries are willing to commit to. And so I don't think we should be overly ambitious about what's possible. An agreement is better than no agreement in most cases. Hopefully in this one, that will be the case. But it does get us to raise questions. And at the very least, it does help justify why it's so important that we're having this conversation about accountability today. Because if there aren't accountability mechanisms built into a future potential pandemic agreement, it's unlikely that the pandemic agreement will have such great effects. So Winnie, back to you. I look forward to the conversation.
Thank you so much, Steve. And now, if we could dive a bit deeper into this, and Barbara, sorry, I'm starting with you again. I know you've been involved so much in, trying to get this pandemic agreement and to persuade and convince and, provide evidence to make sure that we land, on the right stage. So if I can push you a little bit more and say, what governing structures you think would ensure that countries adhere to the pandemic agreement standards, especially during pandemics when compliance is critical? And also, if you could say a few words about, how the pandemic agreement preserves incentives for pharmaceutical innovation while still facilitating fair access to medical advancement. And also this big issue of pathogen access and benefit sharing. How can the pandemic agreement ensure equitable access to medical countermeasures while respecting intellectual properties and promoting innovations? What mechanisms could be put in place to guarantee that lower middle income countries have timely access to essential pandemic-related resources, but also, of course, low income countries as well? So Barbara, sorry to put you on the spot. If you can say a few words about those, we will, appreciate.
No, well, that's great. That's quite a lot in there, Winnie, and I'm sure others will actually join in. But on the governance structures, I think it's no good saying it's completely open now, because we do already have one that's been set up or going to be set up. So we have to somehow, bring that in and not think we can start again. I mean, we originally would have liked to have something like the IAEA, which is for, atomic energy, and go to a model where you had, a team of real expert people who really could do the analysis. Well, we're not going to get that. But that doesn't mean to say that we can't get a lot of information, because in the international health regulations, there's a lot of things that countries are asked to do by way of keeping WHO informed about X, Y, and Z, for example, sort of the pandemic, gets started by some virus or other, and it has to get into the system to be looked at very, very fast. So all those sorts of things that are already in the international health regulations about what you should do give you quite a good database for quite a lot of things. including sort of, individual health surveillance. But that certainly isn't for everything. But there is an enormous amount of data already flying around, with especially as new outbreaks happen and so on. So I think that we have to use a lot of the data that's there and have an independent assessment of the data that is coming in. Now, you mentioned the moment about the pandemic when it's starting to take off and accountability there. And that, for me, is one of the most difficult parts in it, because I, as a citizen, would like to know what my government is doing, and is it following guidelines that WHO has set out or not? What are other countries doing, and what are they learning from it, so that we can do the right thing? Now, there is nothing at the moment that is suggesting in either of these documents that you will really have an assessment of those. And it's also all said too that WHO really doesn't have the right to actually require countries to do things. It has recommendations about what they do. So I think we're only part way there, in that we may find out quite a lot, but we really need more transparency about who is doing what in order to learn, apart from anything else. But that's a real, I would love it, if you could say WHO has said that, with this pandemic now coming up, you really ought to do X, Y, and Z, like not having major public meetings or something. But actually WHO doesn't have the right to tell a country that. And that's sort of a bit of a problem in the middle of this. So some very good data, some areas where we won't be able to, I think, really hit it entirely as to what we want. But that's on its way. You can't have, we need to have what's feasible. I'll let some others answer on more of that, but I'll come on to this question about the PABs and the sharing. And for those people who don't know outside sort of what's going on, the samples of an upcoming outbreak should be sent in anyway to WHO and into the laboratories that are going along with that. And the PABs thing, as it's called, it's about access and benefits that countries, particularly developing countries, are saying, look, if we do the right thing and we give access to these pathogens, then we also want to get something out of it, not individually by an individual country, but as the pharmaceutical industry pick those up and start working with them, we want something back. And there's discussion about this, and I think what actually my panel would say is, what is suggested is something that that could be possible, which is when a company starts producing the goods after getting access to this data and so on, that it ought to give 20% of what it's making either free to developing countries or at cost. Now, that has had an enormous comeback from the industry, the pharmaceutical industry, and also countries who do have themselves big pharmaceutical industries, saying that's really not on, we can't do that much. In particular, there are lots of new small companies that come up who couldn't do it. Well, I'm not sure that's really the case. If you're a very small company and you only have 10,000 items, for example, on a vaccine you only have made 10,000, it's only going to be 1,000 more that you might have to make, and so on. So this is a big one, and it's the probably most contentious issue in the whole of this treaty, the pandemic agreement, and it's setting global north off against global south, really. And in the next few weeks, I think we have to see a breakthrough there. It's right, it's not that the developing countries will get all they want, but certainly they should get quite a lot of what they want, so that they can have access to the drugs and vaccines. That seems to be the right thing in a treaty that's about equity. But it is going to be quite a struggle to get this through. And as I say, oddly, when we started this, I wouldn't have said this was the central point of this treaty, but it is the central point now about people's negotiation, the country's negotiation, and we've got to get that right to get it through. So that's, I'm sorry, Winnie, that was a bit long-winded, but I hope others can fill in as well.
Thanks, Barbara, and please, others feel free. Other panelists feel free to fill in. But also, I'm also going to push the two of you, Maria and Steve, also a bit more. So, Maria, when you comment this time around, you if you want to speak about the 3 points that Barbara spoke to, please go ahead, but also tell us a little bit about what specific monitoring and reporting mechanisms could hold the countries accountable and ensure transparency in their pandemic preparedness efforts. But also, what challenges exist in balancing ideal accountability frameworks with the practical realities of diverse national interest? And you are, you represent Colombia. I know you are not speaking on behalf of your country, but you have experiences that can help, all of us to think about this more. So Maria, if you can say a few words about that.
And yes, I just briefly on terms of what Barbara was explaining on terms of PAPs. Yes, of course, PAPs is the heart of the pandemic agreement, and it's basically the focus of mainly developing countries in terms of really seeing the equity being implemented in the agreement. I think from developing country perspective, there are many other things in terms of how to get to those VTDs, vaccines, treatments, and diagnostics that are required, and we have to see the pandemic agreement as a whole. So not only in terms of PAPs, but in terms of from starting from the beginning of the chain. So research and development, sustainable production. Then you have the transfer of technology and know-how. Then you have the PAPs, and then the supply chain. So we see it as a continuum again, as the word that I use in terms of fakes and pandemics. We see it as a whole. So if you don't have all the elements in place, you can have very detailed PAPs, but you won't be able to distribute, for example, or you won't be able to have the VTDs because you don't have the research and development, or you wouldn't be able to have sustainable production in different regions in the world. So that in terms of that. In terms of monitoring and reporting, so I tried to explain that, but it was a bit difficult to squeeze everything in 5 minutes. So there are different things. So in terms of monitoring and reporting, we don't have much details on this in the pandemic agreement. We do have an obligation to report, and that is in Article 23, if I'm not mistaken. So as usual, as every other international agreement, you need to report on how you're complying with your international obligations. But then what we're trying to do is just try to connect those reports to the work that perhaps an implementation committee could do. Because those reports are being sent to the Secretariat, but the Secretariat just compiled those reports. So we need a body who can assess those reports and try to identify where are the gaps between the obligations of the states and what actually is gonna happen, is happening like in that state. So to do that, you need a specialized body, being in the form of implementation committees or implementation and compliance committees. And that's the reason why we took the experience of multilateral environmental agreements. And not only on an individual level, but it could also be on a systemic level. So that's something else that implementation committees bring. So you cannot only see what is going on, for example, in Colombia, but for example, in the entire region, that in terms of global health and public health perspective is very important. Thanks.
Thank you so much, Maria. And so Steve, also, you started talking about these issues of how the pandemic agreement can preserve incentives for pharmaceutical innovation while still facilitating fair access to biomedical advances. But also, in what ways can the pandemic agreement sustain long-term commitments from its member countries beyond the immediate response to a pandemic? But also feel free to comment on the other issues that Barbara and Maria have spoken about. Over to you, Steve.
Yeah, thanks, Winnie. I think that when we think of what's the problem that we're trying to solve here, I think, well, there's many, but the one that is where we often look to international law to address is when we have collective action problems, whereby we would it's in the whole world's benefit. It's the whole world's advantage, for example, if countermeasures to infectious diseases were distributed on the basis of need and how best to tackle a pandemic, for example. But yet, in the absence of certainty by countries that their neighboring countries are going to kind of follow the rules of the game, there's sort of a race to the bottom that ends up happening. And we saw it with COVID-19 pandemic, where many countries would have probably ideally recognized that the ideal situation is for an equitable distribution of the COVID-19 vaccine. Yet many countries saw other countries racing to procure and hoard as much of the product as they could get their hands on. And as a result, no country wants to be left behind because they have obligations to their citizens too. And so that race to the bottom continues so long as there aren't rules of the game of how things are that countries feel like they can count on and that they're not going to be broken when things get bad. And so in that respect, accountability mechanisms are particularly important, not only during sort of the period of like better understanding how well are we doing to prepare for a pandemic, but where they really get tested, in addition to those times, is also when things get bad, can countries feel like they can count on others to actually follow the rules? And in the absence of that clarity, I fear we've seen way too many examples of countries then descending that race to the bottom. So that's really important. And the reason I frame that and the reason I share it like that is because I think the current draft pandemic agreement is trying to achieve many things. Some of those things could be addressed in many different ways. So for example, if we don't achieve some things like if we don't achieve having standards by which how exactly countries might report on their pandemic preparedness through a pandemic agreement. There are other ways of doing it through, for example, WHO guidelines or through incentivizing it through financial mechanisms, even though that would be really great. And I hope that that gets included because that would be an important advance. Doesn't necessarily have to be we don't have to use international law for that. But there are some parts of this problem that we're not going to be able to solve it unless it is addressed. And so I guess when I look at the draft pandemic agreement, some of the biggest issues, it's unclear whether they're going to be solved, Winnie. As you're saying, like if you look at it, if let's say it's approved as currently drafted, how much better prepared will we be for the next COVID-19 pandemic, whatever it looks like, than we are today? I think we'll be a little better. I think there are some important clarifying norms in the draft pandemic agreement around what countries are expected to do. I think there's some very clear principles that countries are articulating that should be the basis by which they should make individual and collective decisions. That creates a common language. And in the context of an emergency, having a common language, super important. So I'm not diminishing what it's achieved or what it could achieve if it's adopted and ratified. But the biggest issues, like are we mobilizing the financial resources in order to ensure we have the global disease surveillance that's needed? Do we have that clear sense of how and who will make decisions around the equitable distribution of countermeasures? Do we have certainty that countries, if they spot something that looks like a potential public health emergency of a national concern, that they will report it right away? Any more certainty than we would from the existing international health regulations, which focuses on that? I don't think so. So as a result, or even if we are making improvement, it's marginal. And so in that respect, Winnie, I think what's really important is that we try to push the bar. But I also think Barbara's point is really, really important, that we can't, at this point, November 20th, 2024, we're not starting from scratch. We are in a bit of a race to try to get something. I think the recent election in the United States provides, let's say, some motivation to try to finish the negotiation of this potential pandemic agreement in short order. And so I don't think now is the time to open up all the different ideas. I think now is the time to land on what countries can agree to lock something in, which is important. But I just hope that wherever we land, we don't stop the work. I think a lot of the work that different panels have put forward, the different ideas. I think they're extremely valuable. We need to keep talking about them. We're not fully solving all the financial challenges. We need to keep figuring that out because, as Barbara said, it's really, you can't be holding countries accountable if they don't have the resources to actually do what they would like to do and need to do. And so, but that being said, at this point, we probably just need to finish on, let's lock in what we can and let's continue improving over time as best as possible.
Thank you so much, Steve. That, you know, I like the way you concluded. And now we have 10 minutes left. From what I know, we are supposed to stop this in 10 minutes time. So, and I see we have quite a sizable number of audience, you know, people in the audience. And so we wanted to leave as much time as possible for an interactive, you know, Q&A from them. So I now invite our audience for questions to the panel or any comments and contribution anyone wishes to make. Please start by mentioning your name and institution affiliation, and feel free to direct your question to any of the panelists. So Jacob, I will rely on you to spot people that I can't see from my screen. Or if people raise their hands, perhaps I can see the hands.
I don't see any hands raised at this point. So if we don't have any audience questions, we can always proceed with the moderated questions still.
Okay. So I feel that, you know, the organizers of this should also have room to say something, or if you have any comments or questions to the panelists, because it's very rare that you have such a high-powered, you know, panel and people who are in the thick of it, so to speak. So if Jacob, Jorge, or other people in the organizing team have any questions. Otherwise, I'll ask our panelists if they have last minute thoughts, maybe, you know, like 1 minute, 1.5 minutes each, or 2 minutes each, so that we can begin to kind of summarize and conclude. Any additional comments, Barbara? Yes.
Yeah, no, I've just a few things to comment back on what we've been discussing, really. And I think the first thing is this whole issue of trust. Actually, it's really central in this treaty that countries do not trust each other, and most particularly North and South. And somehow we have to break through this, but it's because we don't have that trust. That's why people, particularly the Global South, are so keen to have things, as it were, in writing that they are going to get. There's got to be some things that make them feel that more confidence that it will be better. You know, that they will get those countermeasures, that they will have financing, you know, for the things that they want to do. So there's a really big agenda, I think, to get some of those going. And just to comment a bit on what you said, Juliana, about, you know, sort of getting the countermeasures isn't just a matter of, you know, the PAB section, but I think the PAB section is there and means so much, because in terms of all the things that you need to get the countermeasures, you know, you talked about the four areas. We know that I think the minimum that it will take would be to get to be 2040 before you have any chance of getting regional production across. Now, that's not good enough. I mean, we know that pandemics are due any minute, frankly. You know, we worry as you know, Mpox and so on starts, we all worry again that this could turn into something much more. So, you know, to worry about PABs, it might seem like this is trivial, but it's not when you're going to have to wait quite a long time to be able to do the things that we want. You know, yourself, you're going to have to wait till more of that development's taken place. So you can understand why they want to pin their hopes on something that will just give them something to hang on to in that. That's just a bit of, you know, explanation of the wider bit of this.
Thanks, Barbara. And may I also say we invite the audience to submit questions via chat if they are unable to, you know, speak. Maria, Steve?
Well, I'm happy to chime in. I think just on a more personal note, what I find, I guess, difficult about thinking through these processes and the opportunities in front of us is balancing sort of what we know the need is to protect us from this threat to our health, versus the geopolitical dynamics around what's possible. And I think some of my comments throughout this presentation have really been about well, we want to make sure something matters, but we also have to just take what we can get. And I just wanted to sort of give voice to it's that makes it really hard, I think, for everyone involved in the process. Of course, that's hard for all the negotiators from all the different countries, such as Juliana, yourself. Makes it hard for staff at the World Health Organization. Winnie used to be an assistant director general there. I share that because, of course, there's lots of people who are trying to do good, but this is only one issue that countries are negotiating on. And so I think one of the challenges, I think Barbara said it really well, putting trust at the center of this. There isn't the level of trust that we need in order to tackle some of the biggest issues. And for me, what's the depressing part of this for me is that I can't think of an issue that should be more able to unify countries, because on pandemics, we're all in it together, whether countries like each other or not, whether they have similar economic systems or political systems or not, we're all in it together, and our health is truly interdependent. Yet on an issue like this, despite having such a recent example where so many people lost their lives and all of us were affected, we still can't overcome those differences. That's depressing. The good news, though, is that it's as issues like this and agreements like the draft pandemic agreement give us an opportunity to practice multilateralism. And maybe that sounds naive, but at times when the world's sometimes I feel like the world's getting a darker place, having those forums like the World Health Organization or specific problems we're trying to solve, like pandemic prevention, preparedness, and response, does open those lines of communication, keep them open, ideally inching our way forward to making progress. So I'm both pessimistic and optimistic at the same time. But I think we have to think of this is complicated. It's not so black and white. It's not simple. And we have lots of really good people who are trying to do the best that they can in a difficult circumstance.
Absolutely. Thanks, Steve. Maria?
Well, thank you so much. I guess what Steve was saying is more or less what I wanted to say too. So this is a very difficult process, a process that comes from what we experienced from COVID. So we're not discussing this in a vacuum, and I do see that there is personal commitment and country commitment in order to finish this negotiation and try to have an agreement as best as we can. Of course, not any international agreement is perfect. So we've seen this throughout the experience. Making commitments through a community of 194 states is quite difficult. Everybody's fighting for their own national things. But in here we have something more. We have a global commitment, and I've seen from negotiators and from states that they're really trying to push this to the maximum that we can have right now, and to set the triggers in place to keep ongoing, like to keep adjusting the instruments in the future, be it through annexes, be it through protocols, be it to COP decisions. So this is not the end of the story. I think we need to lay the foundations. Of course, we need to lay very good foundations in order for this to keep evolving in the future. Science is not static. Science will evolve. Pandemics will evolve. Viruses will evolve. So we cannot have a static instrument. So if we lay the foundations and then we can keep working on these issues, I think we can have a very good set of tools in terms of having something else to when the next pandemic hits us. So thank you so much for the panel, and I think it was a very interesting conversation.
Thank you so much. Barbara, Steve, Maria, clearly for those who are watching and those who will watch, this session later, a lot, of very important exchanges have been made. And I just hope that people will go back to this recording and, and gather some of the wisdom that has come out of this panel. But whereas it's hard to, kind of summarize what has been said, and of course, everybody has been listening, there will be a recording available. But like everyone says on the panel, this pandemic agreement really represents a pivotal opportunity to strengthen global health security. However, its success hinges on addressing challenges related to equity, accountability, governance, and things like PABs. At the same time, addressing these issues requires a multifaceted approach to ensure the agreement effectively strengthens global systems. And clear definitions and mechanisms for accountability are critical to foster equity and trust among nations, like you just said. And robust governance structures and monitoring systems must be implemented to hold countries accountable while promoting transparency. And also balancing innovation with equitable access, especially for lower middle income countries, is essential to ensure timely and fair distribution of resources during pandemics. Of course, the same goes even more to lower income countries. And you also mentioned that fostering sustained long-term commitments beyond immediate responses will be key to building resilience, collaborative global health architecture capable of preventing and mitigating future health crises. So with that, I just want to thank everyone, to thank the organizers for inviting us and for, requesting me to chair this amazing panel. I hope this discussion can continue beyond this session, and some of us will see each other even in the coming negotiations and so on. But if we can have an interactive way of getting other views as well from people who are committed to this. I know in the country I'm sitting on, people think COVID is over, but I keep on saying, no, it's not, something else will come. And then came Marburg virus outbreak. And people, after things, crises are not over. So people are jumping up and down, but we need to get to a stage where we can have an instrument that guides us as the world and becomes a shining light for us to overcome these challenges. So with that, I thank you. And Jacob and other organizers, if you have a closing word, please go ahead. I see our time is exhausted, so that's why I'm stopping here. Thank you so much, everyone. Thank you and good luck.
Thank you, Winnie. Mhm.
Yeah, thank you. A special thank you to Global Health Council for organizing this amazing conference, and thank you to our amazing panelists for this wonderful conversation that we've had. And we'll have a recording accessible as well. So thank you very much.
Thank you.
Bye-bye.
And good
Bye.
luck, everyone. Thank you so much.
Thank you.
Bye.